This video shows application of intraoperative CT ultrasound fusion in hip endoscopy for treatment of iatrogenic impingement due to PLA screw, a novel surgical technique. We do not have disclosures. The patient was a 25-year-old female who had suffered from left hip pain for 2 years. The patient was diagnosed with acetabular dysplasia and underwent rotational acetabular osteotomy 9 months before the present case. On CT, there were 3 protrusions of unfired and unsintered hydroxyapatite PLA screw used in previous surgery. To relieve the symptom, 2 ml of local anesthesia were injected between the anterior and middle screws anteriorly under ultrasound guidance. As pain on weight bearing improved 3 hours after injection, the patient was diagnosed with iatrogenic impingement between the gluteus medius muscle and the PLA screws. First, pre-scanning was performed. The transducer was moved laterally to render the gluteus medius and identify the 3 PLA screws just below the gluteus medius muscle. The CT image was fixed at the position where the 3 PLA screw appeared. CT-US fusion was performed by synchronizing CT and ultrasonography at the middle screw. The arthroscope was inserted using ultrasound guidance so that its tip hit the screw. A 1 cm skin incision was also created posteriorly and an RF device was installed. The middle screw had a body protruding from the bone surface, and the screw was unstable. As the screw was ablated, it became increasingly unstable. Therefore, hernia forceps were used to remove the entire screw. The anterior and posterior screws were stable. The tip of the screw was ablated until the surface was smooth. After confirming that there was no extra-articular protrusion, the surgery was completed. Post-operative CT confirmed that the middle screw was removed and that there was no protrusion of the PLA screw on the pelvic surface. Thank you for viewing.